Good day, everyone. I'm Pooja Joshi, your host for today's episode. In this session, we focus on a condition that is common yet often misunderstood: irritable bowel syndrome, or IBS. To help us navigate this important topic, we are joined by Dr. Anshul Bhateja, gastroenterologist at Pragma Institute Hospital, Bhatinda, a respected expert in functional gastrointestinal disorders. Today, Doctor will walk us through early symptom recognition, simplified diagnostic approaches, and effective evidence-based management strategies for IBS in routine clinical practice. Doctor, thank you for being with us.
Hi, this is Dr. Anshul Bhateja. I am a gastroenterologist practicing in Bhatinda.
So, doctor, question for you is, what exactly is IBS and how would you describe it in simple terms to a non-specialist?
So IBS basically stands for irritable bowel syndrome, and it is of further three types: IBS diarrhea type, IBS constipation type, and IBS mixed type. So basically the patient comes to us with symptoms like he has exaggerated urge to go to toilet just after eating the food, and he has a stool frequency of maybe 3 to 4 per day. But the good thing about it is that the stool consistency, he passes formed stools, not diarrhea like loose stools. So this is how IBS can be diagnosed, especially the diarrhea type. And in constipation type, the patient comes to us with pain abdomen, which is often cramping in nature and has concomitant constipation with it. And in mixed type, the patient presents sometimes with diarrheal type illness and sometimes with constipation like symptoms.
Why do you think IBS remains one of the most underdiagnosed gut conditions in India?
So IBS remains one of the underdiagnosed conditions because there is lack of awareness. Lack of awareness amongst physicians themselves as well as amongst the patients also. And secondly, I would say because the symptoms are very vague, it can mimic many other conditions like infective diarrhea, chronic constipation, hypothyroidism leading on to constipation. So these all the organic causes have to be ruled out before labeling the patient as IBS. So I think because there is lack of awareness, especially amongst the physicians, so this remains one of the cause why it is underdiagnosed.
In your experience, how does a typical IBS patient present in an OPD?
So I have already mentioned that patient typically comes to us with cramping type of pain, urge to pass stools, more often after eating food, and it can again vary on the type of the variant. In diarrhea type, the patient has urge to pass stools just after the food intake. And in constipation, the patient has cramping type of pain, but the patient also has constipation like symptoms like straining or the stool frequency is decreased. The patient is unable to pass stools for up to 2 to 3 days even sometimes. So these are the common symptoms with which the patient present to us in the OPD.
What are the biggest myths or misconceptions you hear from patients about IBS?
The biggest myth or fear in the patient is that they confuse IBS with IBD. IBD basically stands for inflammatory bowel disease, and it also has subtypes like ulcerative colitis and Crohn's disease. So this is basically an organic disease which we can appreciate even on colonoscopy. And on colonoscopy we can visualize ulcers, strictures and these sort of things. And the patient has blood in the stools. But in IBS, the patient never has blood in the stools and colonoscopy is essentially normal. So this has to be clarified, especially for the patients who are fearing or confusing IBS with IBD.
Is IBS really a stress disease or is there more to the story?
So yes, stress plays an important role, but because ongoing research has shown that there are multiple factors involved with it. So there is something called as gut-brain axis. So our gut and brain are connected with each other. Even our gut is known as second brain. So sometimes if we are having excessive stress related to maybe work or environment or some ongoing health issues, so IBS symptoms can worsen with stress. Number two, there is something called as microbiota in our gut. So basically, it means that we have good bacteria as well as bad bacteria. And normally, physiologically, good bacteria are higher in number than the bad bacteria. And this ratio is altered in IBS. And number three, sometimes patient has a infection in the gut, and post-infection, the IBS-like symptoms can develop. So this is called post-infection IBS. So not only stress, but there are multiple factors which can add up to the symptoms of the IBS. So there are multiple factors which can add up to the development of IBS.
How does modern lifestyle food habits, stress, and sleep contribute to IBS?
Yes, so this is again an important question because I've already narrated about gut-brain axis. So stress or anything which is leading on to, so stress basically plays an important part because the gut-brain axis is overworked when we are stressed out. So the gut motility is affected by our stress, which leads on to overactivation or underactivation of the neurons. And number two, lifestyle. We are taking processed foods, junk food. So they alter basically the good bacteria number in our gut. So these all things can lead on to development of IBS or worsening of the symptoms of IBS. And especially sleep. Good 8 hour of 6 to 8 hour of sleep is essential to maintain a good sleep of 6 to 8 hour is essential to control the symptoms of IBS.
What are the top 3 red flags that make you suspect IBS in a patient?
In IBS, we do not have some red flags, but in IBS patients, if we do have these symptoms, I'll suspect that the patient is not just having IBS but has something else going on. Number one would be the presence of blood in stools. Number two, the patient has any sign of organic disease like fever or rashes. Number two would be sign of any underlying organic disease like fever. And number three would be some blood markers which are suggestive of inflammation like ESR or raised CRP, which can be of paramount importance in differentiating IBS from IBD especially.
What simple screening questions can a consulting physician ask to suspect IBS?
In IBS patients, we should inquire about number one, sleep habits. Number two, we have to inquire about blood in stools. Number three, stool frequency. Number four, stool consistency. And we have to rule out all the organic diseases before labeling the patient as IBS. And we must classify whether it is IBS diarrhea type, constipation type, or mixed type.
How important is the patient's history compared to investigations in IBS diagnosis?
So, both history as well as investigations are important, but history and physical examination carries a paramount importance while evaluating a patient. So history, we can have increased stool frequency, exaggerated gastrocolic reflex. That is, the patient has a urge to pass stools just after eating the food, or there is cramping type of pain just after the food intake. Usually, there is absence of nocturnal symptoms in IBS patients, and we have to also evaluate our stress-related factors. And we have to eliminate if there are any stress-related factors via meditation, stress relieving techniques. So these are the things which should be done at a basic OPD setting. And secondly, if we are very suspicious of any organic underlying disease, a sigmoidoscopy or colonoscopy can be helpful.
How do you apply the Rome 4 criteria in day-to-day practice? Can it be simplified for general physicians?
So as per the Rome 4 criteria, the mandatory symptom is recurrent pain abdomen, which should be present at least once per week for last 3 months. And the pain should be associated with worsening or improving after the stool passage. Number two, change in stool consistency. Number three, change in stool frequency. So this is a really simple way to apply the wrong food criteria in OPD, and it helps to diagnose or rule out the and it helps to basically diagnose IBS in OPD setting.
Thank you, doctor, for sharing such valuable insights on IBS. Your clarity and practical guidance will certainly help both physicians and patients approach this condition with more confidence. To our listeners, thank you for joining us. Stay tuned for more expert-led conversations. Until then, take care and prioritize your gut health.